All right, good morning, everyone. My name is Gina Ford. I am the Communications Director for Prince George's County Executive Angela Also Brooks. We are here this morning because, of course, yesterday evening we were notified of our first confirmed COVID-19 case in Prince George's County. I will tell you that here in the last several minutes there have been new developments. So I will bring up County Executive Angela Also Brooks, followed by Prince George's County Health Officer Dr. Ernest Carter, followed by Office of Emergency Management Director Ronnie Gill, and finally Mr. Barry Stanton, who's representing Prince George's County Public Schools.
Thank you. Good morning. We thank you so much for coming out to join us this morning as we share some updates with our community regarding the novel coronavirus known as COVID-19. First, I want to thank everyone throughout our county government who has been working really diligently to prepare us for the eventuality that we would have our first case. We always knew that it was not a matter of whether we would have our first case, but instead when. And so it is here, and I want to thank them for working diligently over the last month to prepare us for today. I'd also like to thank all of our residents for their patience and understanding as we have gathered the information to present to them this morning. We wanted to make sure that whatever information we shared was the most accurate and up-to-date information that we had, and I want to thank each of them as well for doing their part today and moving forward to prevent this respiratory illness from continuing to spread across our community. I am really honored this morning to be joined by a number of our county agency directors. I want to thank them for being here. I also would like to thank and acknowledge my county council colleagues who are here and who have been fantastic partners to us. In particular, I'd like to thank Chair Todd Turner, who is standing with us today, and to acknowledge those who are joining me here up front, including Major Riddick, who is our Chief Administrative Officer, Dr. Ernest Carter, who is our Chief Health Officer for our Health Department and who you will hear from this morning, Ronnie Gill, Director of our Office of Emergency Management, Barry Stanton, our Chief Operating Officer for our public school system, who is standing in on behalf of Dr. Monica Golson, who was not able to be here this morning, but we have been in regular conversation and contact with her and will continue to do so. Last night, the Maryland Department of Health State Laboratory confirmed that a Prince George's County resident in her 50s has tested positive for the novel coronavirus, COVID-19. This individual contracted the virus during a trip to Boston during the dates of February 25th through 27th. We were just alerted to this positive case at about 6 o'clock last night, so you will understand that we are therefore still conducting a significant investigation to determine further exposure within the county. You also heard a moment ago from our communications director that we were alerted probably 10 minutes ago that there are 2 additional positive cases in Prince George's County. This is a couple who traveled internationally and came back from a cruise, but they tested positive as well, and we just received that information about 10 minutes ago. What we know right now regarding the first individual is that she is at home. She is in good condition after receiving medical treatment. She was never in contact with any school children, does not have children in our school system. She likewise did not attend church here in Prince George's County, and her family members that live with her are also self-quarantined in the home and are in good condition. I know preliminarily, although we again have not had an opportunity to conduct the investigation on the couple that we just learned about, but I do have information that they are likewise at home as we speak, that they are self-quarantined, and that they are in good condition. We also know that our residents are deeply concerned about this virus and about an recent exposure at National Harbor between the dates of February 27th to March 1st at the Gaylord, where an individual tested positive for COVID-19 after returning to their home state of New Jersey following the Conservative Political Action Conference. You should know that that investigation is being led by the state of New Jersey in conjunction with the state of Maryland, and we will continue to share information as we have it. Anyone who attended or worked this conference may be at risk of exposure, according to the Maryland Department of Health. I want you to know that our Chief Health Officer, as well as our Health Department, did make a site visit yesterday to meet with employees, to share information and resources, ensuring that any county resident who may have been attending or working this conference are taking the necessary precautions. What we want to do today is to assure Prince Georgians that we are monitoring the rapidly evolving situation surrounding COVID-19. We are going to continue to do so in a way that is open and transparent, and we want to share and will continue to share the latest updates with our community on what your county government has been doing in conjunction with our partners on the council and other electeds to prepare for this COVID-19 virus. The Prince George's County government has coordinated efforts among all agencies to address COVID-19. This effort to this point has been spearheaded by our health department. Our county health department is also in constant and regular contact with our state and federal public health partners and receiving the latest updates so we can continue to take the appropriate steps necessary to keep Prince Georgians safe and healthy. On March 4th, prior to any confirmed positive cases in the state of Maryland, we decided to activate both our Emergency Operations Center, our Joint Information Center at an enhanced level. We have had staff working around the clock to monitor updates on this situation. We have maintained the same level of activation since the first confirmed cases in the state of Maryland were announced last week, and since the most recent announcement that there may have been exposure risk at the recent CPAC event at National Harbor. In response to the first positive case in Prince George's County, today I am raising the level of our Emergency Operations Center and Joint Information Center from enhanced to a partial activation. What this does is to release additional resources, brings to bear a number of additional county employees who will be working around the clock to further collaborate and ensure that all necessary steps are being taken to prevent the spread of germs and this respiratory illness like the COVID. Our Office of Central Services is working with the Office of Emergency Management to quickly obtain essential items ranging from sanitizing supplies and cleaners to protective clothing and equipment. Additionally, OCS intends to make full use of its 100,000 square foot warehouse for stocking, inventory, and fast delivery of essential items and supplies. Our Office of Central Services is also instructing the county's custodial staff to incorporate cleaners that are EPA-registered antimicrobial products for use against COVID-19 into our existing daily routine cleaning of all of our county government buildings, and we will continue to do this. This will include placement of hand sanitizing dispensers throughout the common areas of our government buildings to ensure that our employees and residents who visit our buildings are safe. Our Department of Family Services has been in close contact with our senior centers. As you know, we are very concerned about our seniors and others who may have chronic medical conditions. So we've been working with our nursing facilities across the county. They have implemented the Centers for Disease Control guidelines to ensure that our seniors remain safe and healthy, and are following flu and virus prevention protocols to ensure facilities are thoroughly cleaned and disinfected. And more specifically, for our seniors who aren't in nursing facilities, many of whom, as we know, may not have access or knowledge of the internet. Many of our seniors likewise do not have smartphones, and so we have been working to get information out to them via hand delivery. We've actually been taking around that information to those facilities, including a fact sheet on the coronavirus that has gone to all senior nutrition sites to be passed out. And it's also being included with meal deliveries to homebound seniors this week. This fact sheet has also gone out to all of our senior apartment facilities to be distributed by hand to all residents. The Maryland National Capital Park and Planning Commission, Department of Parks and Recreation of Prince George's County also continues to monitor its facilities because we know many of our residents use those facilities, but they've been monitoring them to ensure that supplies are on hand and that they are properly cleaned. At this time, the department's programs and services will continue on a regular schedule. Our fire and EMS department has already confirmed as well that they have enough personal protection equipment for all of their employees, and we are working with our police department to ensure the proper equipment is available for all officers as well. We also have new procedures in place with public safety communications to screen symptoms via phone, and guidelines in place as well to ensure that staff responding to any of these emergencies can take appropriate precautions if the resident has signs or symptoms of COVID-19. Our Department of Public Works and Transportation, as of this moment, has not canceled or modified any transportation services at this time. And so we want that to be known by our residents. The transportation services will continue as usual, but they are ensuring that universal precautions for infection control are being included in the daily cleaning of our county's bus system, the bus. Our buses will now be cleaned at a minimum twice a day. The Department of Public Works and Transportation is also preparing contingency plans for alternative modes of transportation for many of our vulnerable populations in our county. We want to ensure, for example, that those who are receiving dialysis treatments will be able to continue that no matter what happens with transportation. We have alternative plans to make sure those individual patients can be transported for their treatments. For our government employees, I want you to know that our Office of Human Resources Management has been working around the clock to ensure that where appropriate, telework will be able to be used. We also want to reduce the number of staff in the workplace. In addition, the county government will be sending all of its employees information that will be helpful to them at this time. We will continue to communicate with them. In regards to events, we are reviewing all of our upcoming major events and making a determination about whether or not to postpone these events, and we will be doing this on a case-by-case basis. Today, and it gives me great sadness to do this, but I am announcing my decision to postpone our Women's History Month luncheon that is scheduled for March 26th. We are also postponing our Census Block Party, which is scheduled for March 28th. We are doing this out of an abundance of caution, and we'll provide further updates to the community when we have new dates for these events, as well as we make decisions regarding other events that we may need to postpone. Finally, we have produced a number of fact sheets and infographics discussing the coronavirus and several easy, everyday actions that we want residents to take to prevent the spread of germs. These actions include: please wash your hands as often as possible with soap and water for at least 20 seconds. If soap and water are not available, we ask people to please use an alcohol-based hand sanitizer with at least 60% alcohol. Please cover your coughs and sneezes with a tissue or use your elbow. Avoid touching your eyes, nose, and mouth. Clean and disinfect frequently touched objects and surfaces, and avoid close contact with people who are sick. And if you are sick, please stay home, except to get medical care. These fact sheets with information have been distributed to all of our county agencies who are consistently posting those materials on social media. We are also, because again, there are many of our residents who do not have access to social media, we are bringing those flyers to community events and also sharing them with community partners like our senior centers and our libraries. According to the Center on Disease Control, some residents are more at risk of potentially contracting COVID-19, such as our seniors and those who have chronic medical conditions like heart, lung, and kidney disease. We advise those individuals to please take precautions, including staying at home as much as possible and away from high traffic areas when in public. Please avoid contact with those who are sick and wash your hands often, and have access also to several weeks of medications and supplies. We ask our partners in the media, and we thank you in advance also for helping us to share these resources with Prince Georgians to ensure that this information is reaching everyone. We ask Prince Georgians to stay informed. You can do this by calling our hotline. This number we know will be posted, we hope, as we air here, but call our hotline at 301-883-6627. Again, that is 301-883-6627. You may also visit our website at health.mypgc.us/corona, CORONA virus. And also you may follow us on social media at CEX Also Brooks. In addition, we are printing this information and trying to distribute it to as many residents as possible. And I want to make a point about 911. We are please asking our residents to only utilize 911 for emergencies. We have two other modes to contact us if you have general questions or concerns about the coronavirus. You can call our hotline, again, 301-883-6627. You may also dial 211 to get information about the coronavirus, but please do not overload 911 unless it is an emergency. Staying informed is absolutely critical, as misinformation about COVID-19 can create fear and hostility that hurts people and makes it harder to keep everyone healthy. That's why we are working to make all of these resources, information, and updates available to our residents in as many ways as possible. We have translated, for example, much of this information into Spanish, French, and Vietnamese, because we want to be able to communicate with every aspect of our community, and we ask you to please help us to make sure that that happens. Again, what you should know today is that the county, our government, and all of our partners are doing everything we can to respond to this rapidly evolving situation. The health and safety of every Prince Georgian is our top priority, and we will continue to take the appropriate steps and provide the latest updates to protect the well-being of all of our residents. This is a concerning challenge for Prince Georgians. By working together, we are fully prepared and we are well equipped to handle this situation. So thank you so much